Okay, hello everyone. It is May 8th, 2012. As I said in the last blog, I would be getting a second opinion, which was supposed to be on the 8th of May, and they switched it to May 4th. So actually, the second opinion took place Friday, May 4th. Went to Fox Chase Cancer Center in Philly and met with one of the oncology surgeons. I thought that my decision would be to be treated at Fox Chase. However, after the second opinion, I really wasn't impressed, with all due respect. And without getting into all the details, I'm going to stay with my doctor, Dr. Eric Miller, here in New Jersey. He is out of Voorhees. And I'm very happy with him. However, I did want to get a second opinion. A lot of you had been pushing me to get the second opinion. I didn't feel that this doctor at Fox Chase was being as thorough as my doctor here in Jersey. There were some things that he said he wouldn't even have done, including the MRI. He just felt that it just wasn't needed. They had enough evidence, and there were some other things that he said he wouldn't do or he would do, and it just seemed odd. So without degrading his expertise, his medical experience, or insulting it rather, I just will leave it at that, we are going to go ahead and stay with Dr. Miller in New Jersey. So as of now, the surgery will be on the 25th. We will go ahead and move full speed ahead with that. It'll be May 25th. That is on a Friday. That is the Friday of Memorial Day weekend. I think I have to leave here at like 5:30. I think I have to be there at 6, and surgery starts at 7:30 a.m. And that is Virtual Memorial Hospital in Mount Holly, New Jersey. So, as I said, surgery starts at 7:30. It's roughly a 12-hour procedure. The other thing I wanted to say is that I was concerned about chest pain and discomfort. The x-rays that were taken came out clear. Thank God for that. I was really, really concerned about that. They just put me on a muscle relaxer. I've taken 3 so far, and I am actually seeing a big change in some of the pain in my back and in my chest. There's a lot of knots, and so it has seemed to calm them down a little bit, so I don't feel as much pain. Headaches are gone, and I don't feel as much pressure, so that's a good thing. Not a big pill taker, but I'm smart enough to know when it's appropriate to take medication. So in any case, let's see, pre-admission is on the 11th of May. That's where I get the x-rays and the blood work and the EKGs done. The 24th, the day before surgery, I will go in. They will inject in both breasts a radioisotope. Once again, it's a radioactive liquid that they inject into my breast. And then the day of surgery, when I'm actually asleep, they'll inject another injection, which they call a blue dye. And this all just simply helps make the cells of the lymph nodes more clear. It's almost like they glow, so they'll be able to identify with those that they may. Well, the sentinel lymph node biopsy identifies cancer cells in the lymph nodes, and or if it's spread outside the breast. So that's what the procedure is done for. Now at this point, and it'll be on both sides. So some of the concerns are, it's called lymphedema, and that's the swelling of the hand and arm. and it simply means that fluid can't leave the arm through its normal channels in the armpit. There's no cure for that, and then you must protect, you know, the arm for the rest of your life. So there's concerns of that. I think they said it's like a 6% chance that that will occur. So, like I said, there's concerns of that happening, but at this point, I want to move full speed ahead, get the surgery done. Yes, it's frightening and just weird, losing both of my breasts. There'll be no feeling in them at all. Having it's called a bilateral mastectomy with a trans flab. Again, where they take the flab of your stomach. In my case, it'll be both. Really, the whole. It's like a tummy tuck. So they'll be taking the tissue from the stomach and doing reconstructive surgery with that tissue and muscle from my stomach and replacing it onto my breast. Sounds kind of weird, but seeing some of the pictures, it seems to be successful. Looks pretty good. We'll see what happens. So just, you know, some anxiousness and, you know, with the surgery. So not only will I have to, you know, have the reconstructive surgery on my breast, have my breast removed, but also they have to go into my stomach muscle, and then also in the lymph nodes of my arms. So I'll be pretty debilitated, won't be able to do a lot. You know, one patient that I talked to, she's a cancer survivor. She's on her 7th month after the same surgery that I had. She's still home, not 100% yet. And then there was another one that was a year later, and she still is not 100%, you know, back in the saddle. So I don't know. For me, for those that know me know, I'm like thinking 2 months and I'm going to be, you know, off and running. So it's hard for me mentally to comprehend because I'm just such a busy and multitasking type of person that I just can't even conceive being down for that long. So we'll see what happens. In any case, once again, I'm encouraged. You know, fear always tries to sneak its way in, and that's absolutely normal. It's really the not knowing. I have to wait till after the surgery and after they've biopsied both breasts and they've biopsied and checked the lymph nodes to see if there's cancer anywhere else or if it's spread outside of the breast, which would determine if I would need more treatment, more surgery. As of right now, I don't need radiation and or chemo. So let's hope that when they go in, they get everything that they need to get and that it hasn't spread anywhere else. This is traumatizing enough, to say the least. So, you know, I think after the fear and the anger and the shock, it's still, I wake up and I'm like, this is like a dream. It's like everything changed in the blink of an eye, as if I wasn't going through enough. But you know, at this point, after it's all sunk in, I'm so excited. I consider this that it will be a testimony no matter what the end result is. And I'm excited. I'm looking very forward to telling my testimony even more, and to be an encouragement to others that are going through. You know, we go through trials in life and we have a choice. We either deal with them head on, or we run from them, they don't go away. And it just really is a matter of how we deal with our issues. So I can't run from it, so I might as well put my boxing gloves on and, you know, and battle it out, duke it out. And I am a competitive person, so I am determined to beat this thing and send it on back wherever it came from. So anyways, I hope everyone's having a good week. Make the best of your days despite your storms and issues. Remember, you woke up and you're alive. Everything else is fixable and is doable. So you woke up, you're breathing breath, and again, that's just an amazing thing in itself. So God bless you guys. I love you all. And until the next vlog.